Welcome back to Expediting Change. It's your host, Shomari James. We are here with a dope guest. Man, listen, man, we talk all things wellness because if you are not well, you cannot build generational wealth. So welcome back to Expediting Change. Let's get it. What's up, man? How you today, bro?
I'm great. I'm great. Thanks for inviting me. I appreciate it.
Oh, man, it's nothing. We just talked about you stood us up a couple times, man. But you're so popular. Now we got you here.
I'm glad to make time.
Appreciate it. Why don't you introduce yourself?
Sure. So I'm Dr. David Bowman. I am by training, a pediatrician, by passion, a lifestyle medicine physician.
What does that mean?
So lifestyle medicine is a whole new field of medicine. It's been around for maybe 20 years. Lifestyle medicine is basically going to 6 different lifestyle interventions. It's nutrition, physical activity, stress management, sleep, avoidance of risky substances, positive social connections. Using these things is the initial way that we can transform people's health. So it's not just prevention. Most people think about that as prevention.
Yeah.
And that's how I thought about it. I'm a physician, that's how I thought about it. You do all these things, but once you have your health condition, it's a wrap. It's like, no, if that's the reason why you had the problem, pills and procedures are not the answer.
Sure. So you done already said a lot. Shit, where do I go? Because pills and procedures as a physician is already controversial right out of the fucking gate. But I do want to back up. Which do you love more though? Pediatrician or lifestyle?
Lifestyle.
Really?
Yeah.
Really?
So it's interesting. I was a general pediatrician at Howard for 7 years.
Ain't you?
Up until January.
Okay.
And now I'm the assistant dean of student health and wellness
Fire.
at Howard, and I'm also the director of the Spiritual Health and Wellness Center.
Nice.
And they asked me what kind of clinic do I want to run, and I was like, I want to do adults. Not because I don't love kids, but because I do.
No doubt.
Because when I'm going and seeing these kids with obesity, with prediabetes or asthma or GI issues, constipation.
Yep.
It's not the kid's fault.
Right.
It's the parents.
For sure.
And so I had one family, 3, 5, and 1-year-olds. Man, they're running around the room like rugrats.
For sure.
Like
in your clinic?
Yeah, in the clinic.
Okay.
Just open up the drawers, fighting, arguing. It was just like, what is going on? So I thought maybe it's just a new setting.
Okay.
So I asked Mom, is it like this just because they're here?
Yeah.
Or is it like this all the time? She goes, every day, all the time. And I'm like,
They was feeding them red dye.
Beyond that.
Okay.
So sugar, red dye, blue
I'm sorry,
dye.
I wasn't trying to get to the punchline, but I always talk about this. Everything is the red dye. It's my bad. Go ahead, go back to your story.
It's truth. So, I was going through like, what's going on with these kids? And of course, Mom had in her bag, Oreo cookies and what else did she have in her bag? Some other Takis and Doritos.
Oh my God,
and
Takis are the worst.
At the moment, the kids are like, okay, thank you. And calm down for a minute. And then going back to doing their thing. Now, here's the thing, is Mom was 30 years old, obese, mildly obese, not morbidly obese.
For sure. Aren't we all at some point mildly obese? Isn't like the measurement for obesity like something ridiculous? Like LeBron is obese, right?
That's a whole nother story.
Okay,
we can get to that later.
Okay, bet. That's fair.
So when it came down to that family, so Mom is obese, 30.
Yep.
Grandma's 54 on 22 medications.
Gee.
54. Now, I'm 54 now, on 22 medications. And so what I told the Mom, I said, Mom, the predictable and almost certain future of your health is to be like your mother, except 10 years earlier. So instead of 54, it'd be 44.
Why 10 years earlier though?
Just because, just the way that Mom ate, she's 54, we grew up a little differently.
For sure.
And at 30, she started earlier.
Accelerated.
Yeah, exactly.
Okay.
So things Black people are now getting sicker earlier than we used to. We might be living shorter lives a little bit, but we're getting sicker earlier. I told Mom, you're gonna get the predictable and almost certain future of your health is to be just like your mother.
Yeah.
Right? And I said, does that encourage you or scare you?
Right.
She was like, ooh, that scares me. Okay, cool. And I said, and this was dope. This was deep. And I have shared ethnicity with the family, so I could say this.
Yeah.
Because I do not encourage the white medical students or the non-black medical students to say this. I said, the predictable and almost certain future of poorly behaving black kids in America is what?
Ooh.
And her eyes were like, boom.
Whoa.
And
is this your first visit with her?
No, I knew her already.
Okay, all right. I was about to say, she ain't hit you with her purse, bro. Like, God damn.
It came straight out back with that. And so when she said that, she was like, oh my God, I never thought of it that way.
Yeah.
She's thinking about just surviving the day.
Yeah.
She's not thinking long-term, like you said, legacy.
Absolutely.
She's not thinking legacy. She's thinking can I just survive today?
Absolutely.
Right now, when I give them, the Takis and the Oreos, when I give them this, they're happy in the moment.
For sure.
But she's not thinking long-term.
Yeah.
What it's going to do for those kids.
Absolutely.
And so she came back, and to be honest, I didn't think that she was going to actually do it because of all my own cynicism. To be honest, to be straight up, my own cynicism. Like, I mean, she's got this, she's got that. She's on medical assistance.
Yeah.
She's poor, blah, blah, blah. She got 3 kids, unmarried.
Yeah.
Grandma's sick as well. This ain't gonna happen. But I said, you know what? I don't care if I think they will or not.
Yeah.
I'm going to counsel them as if they will.
Absolutely.
And so when she said, okay, you know what? I'm gonna do that. 3 months later, she comes back. She's lost 15 pounds.
Dope. Good shit.
The kids are sitting like this.
Whoa. In 3 months?
In 3 months.
What'd she do?
She took them off of all the processed foods.
Okay.
She was doing still a little bit of chicken, like chicken nuggets.
Yeah.
But she made them herself.
Yeah.
She recognized the family likes avocados. They were doing salads. They were doing a lot of food at home. They cooked from home.
So,
and that was the big difference. They did the air frying potatoes, the fries, instead of buying the fries out. So she did a lot of, what do you call it, takeout foods.
Yeah.
And started cooking from home.
Yeah.
And missed a lot of those chemicals. Yeah. That are poisoning our brain.
So I'm imagine she had to be a little bit above middle class, right? Because in order to do that, taking off of processed foods, it costs much more money to eat healthy than it does to just eat trash. So how do you make those recommendations for individuals who are single moms or single dads? They live in paycheck to paycheck and they always running because they always at work.
Right. So in her case, no, she was below middle class.
Okay.
I didn't think she was going to be able to do. I didn't think she was going to be able to do it.
Okay, for sure.
Now, what's interesting is this: there's a proverb. It's a saying.
Okay.
That if you want it bad enough, you'll find a way.
No doubt.
And if you don't want it bad enough, you'll find an excuse.
For sure.
So, and I didn't say this to her, but just in general.
Well, why not? You said everything else, man.
So, in general, no, I didn't think about it at the time. But in general, if I said, hey, if for 3 months, y'all eat no processed foods, you eat food from home, right? You go to the grocery store and get whatever you need to get.
Yeah.
And in 3 months, everybody gets Air Jordans.
Yeah.
Somehow, they might find a way to do it.
For sure.
Right? But the thing is, we don't think that it's gonna make that much of a difference. And so it's not important to us. If it's not important to us, we don't make that change.
So did she communicate specifically why she decided to make that change?
She was scared.
Scared of what? Scared of death?
Scared of her kids. The kids.
So mom, this is interesting, right? So
tapping into mom's desire for her kids to have a better life than she has.
Which is greater than her own desire for her own health.
That's
because
correct.
she saw her mother, or she could look at her mom, know her mom's on 22 medications, and that wasn't enough. But for her children, she actually decided to make the change.
Right.
That's fire, though.
Yeah.
I respect that.
Yeah. So that's why I want to talk to the adults.
Yeah.
It's not just to the kids, it's talking to the adults. And so that's why my Lifestyle Medicine clinic that hopefully will start in the next month or two will be 3/4 adult and 1/4 kid.
So if that clinic's not open, what clinic did she come to?
This is back when I was doing general pediatrics.
Got it. Okay. So this was pediatric health, but now you've moved, you graduated, you big dog. So now you're opening up your own on Howard's campus.
On Howard's campus.
Tell me more about that.
Yeah. So the goal for the Lifestyle Medicine Center is to go for adults mainly who have heart disease, diabetes, high blood pressure, arthritis, bowel disease, kidney disease, all those health conditions. Almost all of them are treatable and potentially reversible with enough of a lifestyle change. So what's interesting about that is if Tylenol was tested on adults at 50 milligrams and 200 milligrams dose.
Yeah.
Those were the only doses that were tested. They would say, this medication is garbage, it's not effective, it will not get approved, right? There wasn't a therapeutic dose given of Tylenol. So therefore, it didn't help the headaches or the pain or the fever.
Yeah.
Same thing happens with lifestyle changes.
Okay.
That if we typically say, oh, eat healthier.
Yeah.
And exercise.
Yeah.
And that's the advice that most doctors give.
Yeah.
Eat healthier and exercise.
Yeah.
And people are like, oh, okay, well, let me go from, I'll stop doing a Big Mac and fries, and I'll get a Cobb salad from Chick-fil-A.
Right.
And I'll say, I'm doing better, doc. Look at me. This is great.
Right.
Blood pressure number didn't change.
For sure.
And they're like, but I made this big change.
For sure.
And it's like, well, if you didn't know that a Cobb salad has more salt
That's right.
than the Big Mac and fries, if you don't know that,
because of the preservatives.
no, the salt, the literal sodium. Just the straight sodium.
They put salt in it?
Yeah.
That's crazy.
So think about it. Chicken does not taste good by itself.
Sure.
You have to season it.
Mm-hmm.
And if you go to the ingredient list at Chick-fil-A or Chipotle, or what? Not so much Chipotle, but Chick-fil-A, McDonald's, all kinds of stuff.
No shots fired, y'all. Don't try and cancel me, Chick-fil-A and McDonald's. We just talking here.
Well, yeah, I mean, just look at the ingredient list. You'll see what's in there. And literally, Cobb salad has the most calories of any item on the Chick-fil-A menu.
That's crazy.
And it has the most sodium.
Sure.
If you take away the lettuce, you can see why.
For sure.
Right? So what happens is in lifestyle medicine, we say that's not enough of a therapeutic lifestyle change.
Okay.
It's too small of lifestyle change.
Tic-tac to a whale. You had to envision that? You're giving a
Tic-tac
to a whale.
To a whale, yes. Yeah,
What you thought I said?
A well.
Oh,
Yeah.
You're like, what the hell are you talking about?
I was like, tic-tac to a well. Yeah, sure.
Tic-tac to a whale.
To a well, yeah.
Just ain't doing shit.
No.
Just ain't doing
It's not
shit.
enough. And so when you say, okay, if sodium is a big factor in high blood pressure, then we got to really cut your sodium. And you actually have gone from Big Mac and fries to a Cobb salad. And in fact, even Chipotle, if you the tortilla, the tortilla at Chick-fil-A has more salt than McDonald's fries.
Jeez. All right.
The tomatoes have more salt than McDonald's fries.
We done firing shots at Chick-fil-A because they got a lot of money.
Chipotle.
Say it again?
I said Chipotle.
That's what, Chipotle. What did I say? Chick-fil-A.
The tortilla Chipotle has more salt than McDonald's fries.
I don't really eat Chick-fil-A anyway, so I don't even know how I got there. I do Chipotle, but I do the little salad. I do just the greens, the chicken, the meat, and the fresh tomato salsa, some guac, and that's it. I might do a little bit of cheese.
But even the tomatoes have more salt than McDonald's fries.
The regular tomato salsa? Oh, because it's a blend.
It doesn't taste good by itself. I mean, they're gonna add salt to it.
Absolutely. So
all that stuff is important for us to get and understand. If you want to have a breakthrough, we got to understand that. And that's where lifestyle medicine really comes in, that people are really trained about the power of food to prevent, treat, and potentially reverse chronic diseases.
So you said something earlier, which made me think of these conversations, Eastern versus Western medicine. Like, how do you feel, bro? Like, because you went through years of medical school and you came out your mouth and said something disparaging about medicine.
Right. Yeah.
Like, how do you square that?
Oh, good point. So, through my own life changes.
Okay.
Through my own life changes. So, back in 2006, I was so constipated that I was going to the bathroom once every 4 or 5 days. I had hemorrhoids. I had all kinds of issues, right?
Jeez.
So, and then anal fissures, which is a tear in the anus. I'm in the bathroom for a half an hour, blood, sweat, tears.
Oh
like,
my God.
Coming out with bloody turds, like little small turds.
We get real on Expediting Change.
and it's like, I mean, I'm going to the bathroom, I'm literally just sweating, trying to just push it out. So it got so bad in 2006 that I literally was walking around in, I forgot what store it was, and I'm like, what's that smell? It smells like somebody's diapers over here. So let me go over there. And I went over there, and the smell followed me. And I'm like, it can't be me.
So it smelled like shit.
It smelled like shit. It can't be me. And I went to the bathroom and checked myself, and I was like, oh my God, I'm leaking on myself.
So you shit, bro, you shit on yourself.
Yes.
That's crazy.
And so I had to walk around with toilet paper in my butt cheeks at work.
Get the fuck.
Until I had surgery.
What?
So I had to have surgery.
Yeah.
And in the process of seeing the GI doctors and the surgeons, they were like, take Metamucil, take Metamucil.
Yeah.
So they never said, tell me about your diet.
Right.
What's constipating about your diet? Nobody ever said that. And here are the foods you might want to include that would help relieve your constipation. It was all pills, procedures.
Why?
That's all we know.
Is it all we know, or is it all we do because that's the fastest, quickest, and makes the most money?
No, I think in part it's all we know.
Who's we? Let's define we.
Doctors,
Okay.
in general.
Physicians.
Now, that being said, physicians. That being said, it's also because when we have prescribed lifestyle changes, we prescribed a sub-therapeutic dose.
Okay.
A dose that was not intended to ever work.
Yep.
And so like—
Intentionally or?
No, we just don't know.
Okay.
Like we say, oh, just eat healthy and exercise.
Got it.
And people eat healthy and exercise, whatever they think that is.
Yep.
And it doesn't make that much of a difference. It makes a small difference. The blood pressure is 3 points lower, 4 points lower, but not enough to not come off, not to be either started on medication or not enough to come off medication.
Yep.
And so they're like, well, lifestyle changes don't work. Let's just go back to the pills and procedures.
Yep. That's crazy. So was that experience like, well, first off, let me commend you for being vulnerable. Yeah. You just got on my recording and said out loud that you were shitting on yourself, right? Like
I did.
Which is crazy dope as a doctor.
Right.
As a doctor. So you knew something else had to be wrong because you had a higher level of thinking because you've gone through med school, so you knew that these doctors essentially was bullshitting you.
No, I thought that was real.
Even as a doctor though?
Yes.
Wait, go back. So
all
what did you do when they first told you, based off of what was happening, take some Metamucil? You just believed it?
Yeah.
Oh, shit.
No pun intended.
So then I need clarity for my users. I need clarity then.
Got it. When did it change?
You're a physician.
Yes.
You're listening to physicians.
Yes.
You believe in the physician model. How did you shift? Why did you shift?
Good. So I was 6. Fast forward to 2014.
Okay.
December 22nd, 2014. I remember this date specifically.
Yeah.
I was at University of Maryland. I was doing peds, HIV, and global health.
Yeah.
Loving life. This is my life. This is my world. I love it. And they said, well, on a good note, hey, got good news.
Yeah.
That because pregnant women who take their medications don't pass HIV to their babies, that's fantastic for public health. Not good for job security. So they're like, we can't renew your contract. Come July 1st, we can't renew your contract. So they gave me 6 months notice.
Yeah.
And I'm like, 6 months, dang. They're like, oh, we like giving people 12 months. I said, thank God for not having 2 weeks of notice, right? I appreciate 6 months notice. I'm good. And I said, you know what? Here's what I'm gonna do. My church is having a Daniel fast at the beginning of the year.
I'm gonna cut you off for a second.
Sure.
That is literally what got me into my journey years ago and how I stopped eating pork. Daniel fast. We did not pre-plan that, y'all. Daniel fast, bro. Daniel fast. Yeah,
absolutely.
But go ahead.
Absolutely. So my church was doing a Daniel fast, and I was like, I'm gonna do a Daniel fast to hear from God about my next career path.
Absolutely.
Like I'm expecting God's gonna say, thou shalt do sports medicine. Something like that. Right? So that's what I'm expecting.
No doubt.
And so I'm doing this fast for that reason.
Yeah.
Spiritual reasons, not at all for health.
For sure.
Spiritual reasons.
No doubt.
And at the time, the person I was married to at the time said, so 5 days into it, I'm screaming because it's all black beans, brown rice, mixed vegetables. Yeah. And I'm like, I can't do this. Like, this is boring.
It's hard.
I need some help. Yep. This is too hard. Yep. And I was reminded, was this a spiritual fast or a lifestyle change? I'm like,
right.
Spiritual fast.
For sure.
Okay, let me go pray about this.
Yep.
And I started to pray about it, like, Lord, help me get through this. And I remembered I did global health.
Yeah.
I saw people who had died of malnutrition. I saw people, like a number of people who died of malnutrition, or they didn't have enough food. I had one patient, they were, take this medication with food, and the mom's eyes like, food?
Yeah.
We don't eat every day. Damn. And I'm like, oh, you can't take this medication then. We gotta find some other medication for you, right? So I'm going through this fast. I'm like, Lord, forgive me for being ungrateful. Thank you, Lord, that I've never missed a meal because there wasn't enough food. Now, I've skipped meals because of time or whatever, but never didn't have enough food.
Yeah.
So forgive me, Lord, for being ungrateful. Give me the strength to finish this out and give me creativity, whatever I need to do. So I finished the fast, but 10 days into it, my entire life changed because I went to the bathroom and I'd already gone to the bathroom early that day. Now, typically I was going to the number 2 once every 4 or 5 days.
At this point, though, are you, because you mentioned you were wearing the tissue, so
I had surgery. That was gone. Yeah.
Okay.
Yeah.
You just knew still
within.
that was corrected, but you still needed a change.
Yeah, oh, absolutely. I was still constipated. I just wasn't leaking anymore.
Yeah, no doubt. Yeah.
So, which praise God for that.
For sure.
Oh, Lord Jesus, that was terrible. So then I did the fast, and 10 days into it, I was like, I gotta go to the bathroom, but that's weird. I went earlier today, and I don't ever go twice in a day unless it's diarrhea. It's probably diarrhea. And it came out so fast, I'm like, oh, it's gotta be diarrhea.
Yeah.
I turned back and looked, and I saw a log. And I'm like,
yeah, I was talking about
did my
shit, everything on Expediting Change, shit logs.
It's like, did that wife, did she like forget to flush? Because I don't put out logs. I put out hard balls that are bloodstained. That's what I put out.
Ouch.
And so I was like, this can't be real. And I was like, it's the food. Oh my gosh, the food. So my indigestion was gone, my reflux was gone, and I felt great all of a sudden.
And how long at that point were you on the diet?
10 days.
Pause on that. It's raining?
Yep.
Damn. You good? You good?
So here's good?
It's the first time it fucking rained. Okay.
All right.
I'm gonna come back on how long was
Yeah.
So how long was that?
10 days into the fast.
Okay.
10 days into the fast. And I got, you know what, maybe I am fearfully and wonderfully made, but my lifestyle promoted disease.
And say that again, bro. You got to look in the camera and say that shit.
Absolutely. I said, I began to understand that I am fearfully and wonderfully made, but my lifestyle promoted disease.
No doubt. No doubt. No doubt. So that was based off of doing the trauma that you experienced, deciding to do the spiritual journey through the Daniel diet,
right,
and then seeing the physical evidence of what it could do for you.
That's correct.
That's dope.
Yeah.
That's dope.
And so to me, I couldn't, in my flesh, make those changes.
Yeah.
Because me and sugar,
yeah, who don't like a good cookie? Who don't like a good cookie?
I know.
Yeah.
Tight. And so because of that, I was fine cutting out the chicken and the seafood. Because at that time I was not eating beef or pork. I was doing chicken and seafood. That I cut out pretty easily.
Yeah.
But the sugar, it was like I'm going down the aisle, my toes are curling.
Yeah.
It's like the nuts are down the aisle. I want to get the nuts, but the candy's in the same aisle.
Yeah.
I can't do this.
Yeah.
And I was like, hold on, wait. If I say I can do all things through Christ who strengthens me, I can walk past some candy.
Absolutely.
Right? So it's like, okay, I can do it. So at first though, I went around to the backside and got to the nuts. I couldn't walk past the candy to get to the nuts. I had to walk around, not see the candy.
Yeah.
But eventually I'm able to now go past the candy without the temptation, not the same temptation.
No doubt. So because that's key though. You didn't say without the temptation, without the same temptation. Because the shit almost never goes away.
Oh,
right?
Like you
have cravings, but you have to have the discipline to shift your focus. So tell me, probably easier this way, what don't you eat?
Now?
Yeah.
Okay. So now I'm pretty much predominantly whole food plant-based.
Okay.
So I don't eat any animal products. So no pork, beef, poultry, seafood, eggs, cheese, milk. I would say on 3 times a year, I might get some red velvet cake that I will say, excuse me, what ingredients are in this? You know what, let me just go and get the cake.
No doubt. Right? You said 3 times a year?
3 times a year,
okay.
roughly.
All right.
But otherwise, it's all plant foods.
Now, in making that shift, that's a big shift, bro.
Big shift.
That's huge. So a lot of individuals, the first thing that individuals will say is, where do you get your protein?
Yeah, I get that question all the time.
No doubt.
And second question is, are you doing this because you want to be skinny? And then the last question is, but it's really boring. I guess those were statements, not necessarily questions, but can you respond to those 3, especially the protein joint? And I want to talk about the cost. So we talked earlier about the lady with the cost, right?
Absolutely.
So, it's so expensive to eat healthy, right? So let's go back to that lady who
with the children? Yeah.
So what is the most expensive part of any meal?
The meat, right?
Right.
Yeah.
So if I'm eating chickpeas instead of chicken, I'm eating beans instead of beef. I've cut out the most expensive part of the meal.
For sure. Good
and
point.
then now I can add in the vegetables.
Yeah.
And overall, the cost will be the same, if not less.
Okay.
So now, that being said, you have to be very careful how you cook it. Not cook it. How you go to the store. So if you go to, like right now, it's September. Trying to buy some cherries now, they're more expensive than they were in July.
Yeah.
In July, they were $3.99, $2.99 a pound.
Yeah.
Now they're back to $5.99 a pound. I try to get the same cherries in December, they're $9.99 a pound.
Season and out of season.
It's in season and out of season.
Yeah.
So yes, the cherries are expensive with an asterisk, out of season.
Yeah.
Right. So but in season, they're really cheap.
Yeah.
So that's part of it. Is getting the understanding that beans are cheaper than beef, that lentils are cheaper than lamb, right? So you can cut your costs that way. Now, my question about the protein, that's a question I get all the time.
For sure.
Where do you get your protein?
Yeah.
Two things is, one, I get my protein from the same place that your chicken and your cow get the protein. From plants.
Okay.
So your cow doesn't eat chicken to get protein, and the chicken doesn't eat seafood to get protein. They eat plants.
Point.
Right?
Heard it.
Now you got to eat more
Absolutely.
to get it,
Yep.
which is fine. I can eat more. So instead of saying I got to starve myself to lose weight, I can be full and lose weight.
Right.
It's just that the food has less calorie density.
For sure.
Right? There's less calories in beans than there is in beef.
Yeah.
Right? And so you can actually eat more of those things. So that's number one. Number two about the cost is, let me think. So you said, no, the protein. That's the cost.
Protein and boring.
Right. We'll go back to protein. Back to the protein still. From most vegans, and I don't like to call myself a vegan.
Vegan means you don't even
plant-based.
wear leather.
Correct.
Right? Okay.
Correct.
Yep.
Don't look at my shoes. So I'm plant-based.
Yep.
Right. It's more what I'm eating.
Yep.
Now the side effect of that is that animals don't get killed from my food, but I'm plant-based. So when you go plant-based, you still get enough protein. You're just getting it throughout the whole day. So you have to think to yourself, all right, I need to get some more nuts and seeds. I have to get some more whole grains instead of white grains. I have to get more veggies. Like fruit doesn't have much protein. Right? There's a little bit, but not much. I don't really count it. When I'm counting how much protein I'm getting, I don't do that. So for instance, if I got my typical breakfast, oftentimes is oatmeal and a smoothie. So, but my oatmeal is not just oatmeal. I add chia seeds and quinoa to it.
Chia seeds or chai seeds?
I call it chia.
So one is chai and one is chia.
Not chai tea.
Okay.
Yeah.
I learned that the other day. Because I use chia in my smoothie.
Yes. Yeah. Exactly.
Yeah.
So I put chia seeds and quinoa in my smoothies. I'm sorry, in my oatmeal.
Okay.
And I put walnuts on top.
Okay.
So I'm getting plenty of protein there. And then with my smoothie involved, let's say I'm on a fast, right? I do Daniel fasts throughout the year. I have one coming up on Monday, actually. So I do them about 4 times a year. We support them, and we'll talk about that later. So my smoothie, from on the fast, I might put tofu in my smoothie. And then, vegetables and fruits, soy milk, and then flaxseed, et cetera, et cetera.
Do you use protein powder?
Well, not on the fast.
Okay.
Yeah.
Okay.
I use a vegan protein powder when not on the fast.
And what about protein shakes?
I mean, a smoothie.
No. I mean, because the store bought.
No.
Bad for you?
I stay away from.
Like Core Power,
I stay
muscle
away
milk,
from that. Yeah.
all bad for you.
Well, just look at the ingredients.
For sure.
Just for everything. Please listen up. For everything, read the label. Go back to the back and look at the ingredients of what you're looking at, and say, can I get these ingredients on the shelf? If I can't get these ingredients on the shelf, it's highly processed and probably not very healthy. Right? So we just gotta look at the actual ingredients that are on there. So, so with my breakfast, I have anywhere from 34 to 44 grams of protein.
Okay.
At breakfast. That's a lot.
Good,
That's way more than you get with your egg with muffin and cheese.
Yeah,
So way more than that.
Good amount of protein.
Right, and then and my lunch might be leftovers of curry chickpeas and brown rice with broccoli. And then my dinner might be spaghetti that I add lentils as my source of protein and got the whole grains in it. So my whole day I'm getting enough protein.
The pasta, is it like wheat pasta? Like
whole wheat pasta.
Whole wheat pasta.
The chickpea pastas and stuff like that
Yeah.
are really expensive. So
do you miss it? Do you miss beef, chicken? Or
absolutely.
You do?
Yeah.
Jeez, I didn't, you got me. I didn't expect that answer. So what, when you like smell it or just crave it or?
Nah, like a pizza. Yeah, I miss pizza. When I smell pizza, it's like, oh, my toes are curling and stuff like that.
Oh, that's the
Battery?
GoPro.
Right. So with pizza, yeah, my toes curl. With fried chicken, I smell it, and I remember when I was working at Howard. I'm so working at Howard with the Student Health Center. People bring their fried chicken there, and I'm just like, can I lick it? I mean, I just want to lick it. You know?
Right, no doubt.
I just want to lick that breast, chicken breast.
Chicken breast.
Right.
So I'm 21 days in on my fast.
Nice.
It's been hard. Inside of that fast, I did 4 days of only raw fruits, raw veggies, like almonds, pistachios.
I bet you feel good.
I do. And I really like how you drew the difference, that delta between spiritually and for like weight and shit like that, right? Because some people say, well, why are you a vegetarian if you're not losing no weight? And for me, it wasn't about the weight loss. I think I lost a pound, maybe a half a pound. And the scale is a whole nother conversation because, muscle mass and fat,
exactly.
You know what I mean? Total different, but we won't digress into that. But honestly, the biggest thing is exactly what you said. Going and looking at the ingredients and shit, right? Because you have the prepackaged salads with the dressing that have all types of bullshit, but it's so convenient.
Correct.
You can just grab it, mix that shit, and just go.
Correct.
As opposed to literally, we were in the studio doing podcasts, and I ran to the grocery store and I bought separately jalapenos, pickles, lettuce. We chopped it. Shout out to Drew, who sat there and ate rabbit food with me last weekend. But I feel much more clear. I actually went to a party last night, actually, after being on this fast and doing the raw fruits and veggies, and the TV being loud, people talking, the engagement was way too much for me. Now, Shomari loves me a good party. I mean, you know I love a good party.
I know you do.
But being in that spiritual place of having a discipline to cut shit out just completely changed everything. So I definitely feel you on that. My question off of that, though, is what happens between the physical transformation and the spiritual transformation when you put those two together for yourself?
Man, it's powerful. Because to me, when I try to add in my flesh, so going back to the chicken, right? So I still have that same desire for chicken. I have the same desire for pizza. Less than I used to, don't get me wrong. To be honest, it's like this. When I got married, my eyes didn't change. I still saw what I liked. I still was like, oh, my goodness.
No doubt.
Dang, I'm like,
No doubt.
my eyes didn't change.
For sure.
But I just made different decisions.
For sure.
About that.
No doubt.
Same thing. I still had the same cravings for some foods.
Yeah.
I just make different decisions.
Yes.
Right. It's a choice. Everything is a choice.
Yeah.
Everything is a choice.
No doubt.
We feel as if I have to. No, I choose to.
Yeah.
For almost everything that takes place, there's a choice.
Yeah.
And so I choose to do foods that are going to be honoring to my body. So check this out. So back when I was 15, 15-year-olds out there, do not take my advice on this, right? So when I was 15, I took my parents' car out before I had my license, right? I did get caught by the cops. That's another story. That's not part of the story.
Did they call the cops on you?
No, I got pulled over.
Oh my God.
I didn't have my taillight was out.
Okay.
Luckily, it was a black cop that pulled me over.
No doubt.
Long story. Anyway, so I got pulled up by the cops.
Yep.
That wasn't the main part of the story. So before that,
Yeah.
I said, let me go get some gas.
Yeah.
Because my parents might see that the tank moved.
For sure.
So I was smart enough to go get some gas. I'd already pumped gas for my mom, whatever. So I knew how to get gas. So I went to get some gas, put the gas tank get the gas in the gas tank. Cool. All right. I'm back to the car.
Yep.
Did you get in?
Oh shit.
Nothing. I'm like, what's going on?
Yeah.
Oh my gosh. And so what happened was I was with two other guys, and I said, hey, such, what pump number is that? He said, pump number 13. All right.
With diesel.
It was leaded gas in an unleaded car.
Oh.
Back when I was 15, they had leaded gas. Gas, when we say unleaded, there was lead in gas, and we had to take it out, right? So my car was like, I don't want no lead in me.
Yeah.
And now the future chemical engineer in me said, well, if I end up diluting the gas, maybe it'll work.
Yeah.
I ain't had any more money. None of us had any more money, so we had to go and borrow some money from somebody and come back, and it worked.
Okay.
So the maker of the car knew what the ideal fuel was.
Yeah.
I disobeyed, and there was a consequence.
Ooh, put that to your body. I see where you're going. I see where you're going, brother. I see where you're going.
The maker of this says the ideal fuel is whole plant foods. When we disobey, there's a consequence. Now, we're all going to die at some point. I get that, right?
Absolutely.
But the problem is that we end up disobeying so often we have sicknesses and disease. And so almost every single of our health problems, the high blood pressure, arthritis, almost everything that we have is based on inflammation, oxidative stress, not enough fiber, right? So that's whole plant foods, our gut microbiome, et cetera. Too many calories, et cetera. So whole plant foods addresses each one of those. And so now I address the underlying reason for disease. It's like when you think about when you go on the metro. You're in the metro, you got one stop, you got another stop, but you're still on that same red line train. Right? That one stop might be like, the first stop is maybe high blood pressure. But here's some pills for that. Okay, cool. Next stop is going to be obesity. Here's something for this.
For sure.
Next stop is going to be arthritis. Here's some pills for that. Next stop is cancer. We got some pills and procedure for this.
And load it up.
And we never stop that train from going down the track. And that train is inflammation and oxidative stress. So my thing is, if I can consume foods that are anti-inflammatory, consume foods that have dietary antioxidants, I now reverse that train, go back this way, instead of going towards disease and going towards health.
I love it. I absolutely love it. What about pescatarian?
What about it?
Is it okay? Is it good? I mean, fish? Like, it's hard to go from chicken, beef, pork, seafood to veggies.
It is.
Like I did it only, I'm a Gemini. I cold turkey, fuck this, I'm just gonna do it. You know what I mean? And then now, here's the other piece too that we didn't talk about. I can't just go eat steak right now. That's dead. So coming off of the diet, bone broth, absolutely, bone broth, fish. I'm gonna keep it a buck. I ate Sardi's chicken last night and felt terrible this morning. So that, I'm gonna have to figure that out because that's not gonna work, but Sardi's is so good. But anyway, my point though is, how do you get to that point? Like, remove one thing at a time?
Yes.
Okay.
Yeah, so there are two different ways to do it.
Okay.
It depends to me on where you are with your health.
Okay.
So if you have mild diseases, you may be able to make that gradual change. Right? But if you're in the hospital and they're like, I don't know if you're going to be able to keep your leg for your diabetes.
They shut everything down.
Right. So it depends on how strict. But for me, I am a all or nothing kind of person at times. So doing that Daniel fast, I wasn't thinking about the food. I was thinking about the spiritual part. And it was like, I felt so good so fast.
For sure.
That it was like, what the freak just happened to me?
You can say fuck, but if you don't, that's okay.
I know. I mean, it's just crazy to me. So how fast our bodies can heal when we stop hitting it. So like one time I hit my shin on a drawer and it hurt, like 8 out of 10.
For sure.
Over time, it got better, right?
Yeah.
I hit the same shin, same drawer, and pain, and I didn't hit it as hard the second time. But because it had not yet healed, it hurt bad, even though the impact was not too much.
For sure.
We eat a breakfast of, egg McMuffin with cheese or whatever. And we hit it, and our body's like, oh, you hurt me. Okay, but you know what? I'm gonna try to get it together before lunch. And then lunch comes, and bam,
eat McDonald's or
right? And then my body's like, oh, I'm trying to get, if I can get to dinner, maybe you'll give me a good dinner. And then bam, there comes some wings. or something else. And it's just like you're constantly hitting your body all day. And when all of a sudden you just take that away, your body says, I can heal itself. Now, so some people do the gradual thing, and that's cool if you aren't in distress, if you don't think medically your life is at risk. I think that's totally fine. But the problem is you don't feel good for a long while. I want you to feel good like this.
No doubt.
And you're like, yo, okay, hold on. So now if this is, I got an example since you guys have a school here, right? So if you got an F student and they all of a sudden start making C's, you are celebrating. This is great. The standard American diet, and I really want to call it the substandard American diet, is an F. So you make some changes, you get to a C. This is good. This is significant, right? But if you, so getting C's might be good unless you're an A student.
For sure.
If you're an A student, you get C's, you're like, what is going on? When I first got my first C in college, my dad was like, oh, let's see, I gave you a car, so C equals car. That's the reason why you got your C. And it's like, I'm putting the car away. You know, I'm like, no.
That's crazy.
So because I was an A student, I got a C, right?
For sure.
So getting C's, I don't want to see. I don't want to see in any part of my life. I don't want to see it in my marriage. I don't want to see it in my health. I don't want to see it in my finances. I don't want to see it in anything, right? I want an A.
Yeah.
And so I want to take people from an F to an A. Let them feel they feel. And say, let me go and add back in. Okay, let me try if I add in some dairy. Ooh, oh no, dairy doesn't work for me. Okay, let me add some chicken. Oh, no, that doesn't work for me. Okay, let me add in some sugar. Okay, that I don't feel it right now. And then all of a sudden I add a little bit more sugar. Oh, my joints hurt. Right. So, but you don't notice all the things that are hurting because you're just so used to living that life.
Absolutely.
And all of a sudden when you get out of that, it's a beautiful thing. It's
Absolutely.
It's like going from the inner city to like, you know, the mountains and the beauty of the mountains and stuff like that. You're like, oh my God, I can breathe fresh air and I can relax and my stress levels are lower and blah, blah, blah. And it's like, well, you can live in the burbs as an option. You know, that's the analogy, right? You can live in the burbs, you can live downtown, you can live in the hood. There's all kinds of things you can do. And each step that you make is going to be an improvement, clearly.
Absolutely.
But I want to get to ideal.
For sure.
Ideally.
I love that. Absolutely love it. So you spent a lot of game, and I appreciate it. A lot for my listeners to take a look at. So you know why I started this podcast, right? And everything that you're doing, talking about the center with your health. But what are you doing right now today to help for the positive progression of the culture to expedite change?
Excellent. So based on my experience with the Daniel fast and how quick I got better, I started saying, I did a couple Daniel fasts on my own for a while. My mom got sick in 2017. And after 2018, January, the family's gonna do a whole fast. My mom tapped out after 3 days. I need my sausage. You know, she tapped out. My dad said, I'm gonna continue. And within 3 weeks, his high blood pressure was gone.
Nice.
Actually, I'm sorry, with 10 days, his high blood pressure was gone. Within 3 weeks, his medications were gone.
Nice.
Now he went back to his old diet, had to go back on medications, right? But it happens that fast, right? So I'm like, yo, this can work for adults. Like, I mean, I'm an adult, but like, for people who have chronic diseases, this works for them.
For sure.
Yo, so now my wife and I have a business called Lifestyle Med Revolution.
Nice.
And we do Daniel fast throughout the year.
Nice.
We got one coming up on Monday. We do them typically January, do one in Lent. So it's February, March. And then usually May, July, September. We took a break this year because my wife turned 50. And so we're like,
chilling for a minute.
We're not going fast when they're 50.
For sure.
So we started in September. And so that's what we're doing. And we offer it for a low enough price that most people can afford it, but a high enough price that you got a little bit of skin in the game.
For sure.
You don't want to waste, it's only $49. But what's dope is this. Oh my gosh, Shomari. I'm about to kill the game.
Here's the break.
Oh my gosh. So I was at a conference and the National Medical Association conference. I spoke at the Black Doctor Association conference on plant-based diets. Right? And got such positive feedback. One lady there said, you need to be, because I'm board certified in lifestyle medicine. I'm one of the first 5 Blacks who is a fellow in American College of Lifestyle Medicine. So I'm a leader in the field. Right. She goes, you should be a mentor to other physicians. Oh. So now I have a Daniel Fast for healthcare providers.
Nice. Nice.
I'm so excited about this. We can learn about the pathophysiology of why these different conditions and why this food works.
Absolutely.
We can talk about natural weight loss. Yeah. Without having to go to pills and procedures.
Absolutely.
We can talk about, these particular foods help with these particular diseases and get the doctors involved.
Absolutely.
And then so when you go to see your doctor, then all of a sudden they're like, oh, well, you know what? I tried this before.
Absolutely.
I've seen how it helped me. I live, if I call the Daniel Fast an A, the doctor says, I know, I tried the A. I'm happy with a B. I'm sticking to my B. So I do, chicken twice a week. I do seafood once a week. And that's where I'm living right now. And I'm doing a whole lot of foods, whole lot of vegetables, etc. I feel so much better, and now they can prescribe that to their patients.
Absolutely.
So to get
and not only prescribe it,
come on, man.
They now believe in it.
They believe in it.
They believe it, and they have testimony because they personally did it. So don't tell me about something that you're not doing.
Good points. Good point. And I want the doctors to get, because if we have bad health, so if I want some financial advice, I'm going to Shomari. Right? I'm not going to a financial advisor that's broke.
For sure.
Right? If I go to a financial advisor that's broke, I'm walking out their office.
No doubt.
Right?
No doubt.
So our healthcare providers, we need to have better health.
Love that.
And wherever you start from is where you start from. In fact, the bigger the test, the bigger the testimony. No doubt. I'm not, judging anybody.
For sure.
But we need to get ourselves together as doctors.
Absolutely.
And then once we get the doctors together, then the message goes out and every patient that comes through. So now at Howard, for the medical students, as part of my job, I'm doing lifestyle medicine for the students. So I'm teaching the new medical students about the power of food as medicine and the therapeutic dosing of the right foods and stuff like that.
Absolutely.
Right? So I'm doing all that for the medical students. So the medical students at Howard have at least gotten a seed, so to speak.
Yeah.
Pun intended.
No doubt.
They got at least a seed to know this stuff actually works.
Yeah.
And then eventually, if I can get, now with my new position, to get them to really, really get it, not just one lecture, but to really get it throughout the time period. Hey, let me talk to you about your wellness.
Absolutely.
How's it going for you? Oh, I'm stressed about this. Okay, and how are you eating?
Absolutely.
How's your exercise? How's your sleep?
Absolutely.
Because lifestyle medicine is not just about the food. I know we talked a lot about food.
Absolutely.
But it's about, exercise. It's about getting your sleep. It's about getting the stress management.
Absolutely.
And that's a big part. Because a lot of us, we want to do right.
Absolutely.
But the stress is what leads us to not do right.
Love it.
So we allow the stress eat. So I mean, when I'm going through stress, I'm plant-based. When I'm going through stress, I go get me a vegan cinnamon bun, or I'll get me some candy. Right? I'm not going to get other, animal-based products.
Yeah.
I'm still. At best, worst case scenario, I'm getting popcorn
or that velvet cake.
Yeah, exactly.
Velvet cake.
That's right, velvet cake. So yeah, so I will still, when I'm stressed out, I will still not eat. Great.
Absolutely.
But it's still plant-based, so it's not quite as bad.
It's not over the top.
It's not over the top. Yep. It's still worse than what I would ordinarily want for myself.
Absolutely.
But so it's important also for us to talk about that stress level.
Absolutely. My bro, you killed it today, bro. Absolutely murdered it. I appreciate you. I hope that the individuals that are listening to this, they hone in on the things that you said because they're absolutely very, very, very important. And we only get one chance at it.
Right.
We only get one chance. I appreciate you for coming on. Why don't you look in the camera and tell them where they can reach you?
Great. Again, I'm Dr. David Bowman. It's spelled Bowman. I'm on YouTube. I am on Instagram and Facebook at Lifestyle Med Revolution. And that's really how they get it.
Appreciate it.
Yep.
Hey, listen, you heard everything Dr. Bowman just said, and it reminds me of, I believe it was Gandhi, because y'all know I don't fake on this podcast, right? I believe it was Gandhi. Be the change that you wish to see in the world. During this conversation, that's everything that I felt. Dr. Bowman had a testimony, but that testimony in his own words was one that was powerful and potent enough for him to make his own decision, to have the discipline to shift his lifestyle. I absolutely loved, right, as I closed and said, we only get one chance at this. We only get one body. The unleaded versus leaded fuel was an absolutely dope description. If you can't stop yourself having the discipline of what you're putting into your own body, how do you think that's going to translate to your finances? You have to have spiritual wellness, mental wellness, and physical wellness before you can start talking about generational wealth and getting to the bag. And it all boils down to what I believe is two words that Dr. Bowman said throughout this entire podcast, whether he said the word explicitly or based off his description: discipline and consistency. He said, I want to come in and have discipline consistently to have an immediate change. Yes, we can graduate this thing, but I want to have a big bang. I want to have breakthroughs right out of the gate. And the only way to do that is to have discipline. I encourage you to have discipline. I encourage you in that discipline to have consistency. And then we can go from financial wellness, spiritual wellness, physical wellness, mental wellness, to generational wealth. This has been Expediting Change. I appreciate y'all for listening.